I think it's fair to say that the whole of Scotland's health could improve as a result of this. At the moment, much of our data about the ill health in Scotland is based on various surveys, and probably the most consistent thing is the medical cause of death. But actually, why aren't we looking upstream of that and actually looking at the illnesses that are out there at the moment? Are there specific illnesses which are causing a disproportionate problem in the community? And are there things that not just the practice need to address, but actually Scotland as a whole needs to address to improve that? This is going to allow us to extend the data we've got already to actually show that the patients are getting this care they deserve across Scotland. But actually at practice level it's going to have a different effect, because it's going to allow us to investigate the richness of the data that we've been collecting for a number of years. At the practice level, we've been collecting data for many years. We've been increasingly computerizing our records. The great advantage of that is we can actually track over time to see that the care that we believe we're giving to our patients, we're actually going to get that. Well, the change is that up until now, our contractual framework has looked at specific diseases such as heart disease, diabetes, and chronic obstructive airways disease, which are all important, but we're well aware that other things are missing from there. So this is going to allow us to collect the data for things like rheumatoid arthritis and other conditions that people are looking at with long time, so that we can decide, okay, let's have a look at these patients. Are we providing the care we think we are? Let's deal with that, and let's track those patients who are not getting that care to make sure that we can seek them out and give them the care that they need when they need it. I'm aware that my colleagues may find that this is just another thing to distract them. I would be very reassuring to them. I think that this is going to fit neatly with what they're doing already. And it's going to allow us to make sense of the data that we're collecting. At the moment, some of the data, well, why are we collecting that data? But if there's a reason about why we're collecting that, actually we can see a point in that, so we can go back to that data to help us to improve individual patient care. I think that's going to be a great asset to our practices. Partly it will mean that actually groups of practices will be able to come together to compare the data they're providing so that we can learn from each other. So if a practice next door has got a better appointment system than mine, well, I want to know about that. I want to see how that can improve things. And equally, I would like them to learn from what we're doing. So it's going to give an incentive to practices to buck up the quality of care that they're doing at every opportunity to make sure that the consistent care is being provided to all our patients across Scotland.